Hi, I'm Regina Gould, a PA, and I'm going to show you how to change a tracheostomy tube, or trach tube. Your provider will tell you how often you need to change your trach tube. For most people, it's changed every 1 to 3 months. If your trach does not have an inner cannula, it may need to be changed more frequently. When doing a trach tube change, have a phone nearby so you can call for help if needed. But most trach tube changes go smoothly. First, you'll start by washing your hands. Clean hands are really the best way to prevent spreading germs. Gloves are optional. Next, gather the necessary supplies. A clean, stable work surface, same size trach tube with obturator, 10mm syringe for trachs with cuff, sterile water if you have a trach with a water cuff, lubricant, Velcro trach ties, scissors, tweezers or a clamp, towel, saline bullet, suction setup, a suction catheter, 14 French is preferred, self-inflating ambu bag connected to oxygen, and a face mask for patients on a ventilator. New inner cannulas for trachs that need one. Check the trach tube to make sure there are no cracks or tears. If you have a cuff trach tube, test the cuff by inflating it to make sure it holds air or water. Then deflate the cuff completely. Attach the new trach ties to one side of the new trach tube's wing holes. It may be necessary to trim the ends of the ties so that they pass easily through the wing holes. The obturator is inserted into the new trach. This is a device that sits inside the trach tube to create a rounded, gentle tip that enables the trach to pass easily into the stoma, or hole. Moisten the new trach tube with a small amount of water-based lubricant and place the trach back into the clean tray. When you are ready to start, place a rolled-up towel behind the shoulders to get a clear view of the neck and tracheostomy site. For self-trach changes, have a mirror set up and lift your chin to better visualize the neck and stoma. Wherever you perform trach care, ensure comfortable breathing. If suctioning is needed, do this first before you release the trach ties and remove the trach tube. If the trach has a cuff, remove the air or fluid to deflate it. Then, while stabilizing the trach, release one side of the trach ties. Gently remove the old tube and briefly assess the stoma site. Insert the new tube, approaching at a 90-degree angle and rotating down as you insert. Never force the tube if it does not easily go into the stoma. If you are unable to reinsert the new tube, refer to your emergency training. Remove the obturator from the trach tube. Attach the trach ties on both sides of the neck. To check for proper fit, you should be able to place only 2 fingers between the skin and the tie. Look and listen to make sure air is moving normally through the new trach. You may need to pass a suction catheter to ensure there is no obstruction. For trachs with inner cannulas, reinsert the inner cannula by holding the trach tube steady with one hand while placing the inner cannula with the other. Inner cannulas should be changed every 12 hours, or as your care team recommends. Coughing may occur with the trach tube change. This is normal. Suction the tube if necessary. Irritation may be present from granulation tissue, causing a small amount of bleeding. Reach out to your care team if this continues or increases after the procedure is complete. Now that the trach is secure, you can perform trach site care. Depending on your home care company and type of trach tube, you may be instructed to clean the old tube with soap and water and reuse it, per the manufacturer's guidelines. Be sure to clean and keep the obturator as well. Once the trach tube is dry, store it in a dry container for reuse. Once your care team has decided you no longer need the trach tube, we expect the following. You will be switched to a smaller cuffless trach tube for a minimum of 24 hours. The small trach tube will be capped for a minimum of 24 hours. If there is no shortness of breath or need to remove the trach cap for suctioning or breathing, the trach tube can be removed. The stoma will be covered with an occlusive dressing and changed as needed. When you speak or cough, you will need to apply pressure with 2 fingers onto the occlusive dressing. The stoma usually heals in days to weeks. Rarely, a fistula or persistent hole remains and would require a secondary procedure to close. If there is still air passing through the stoma, please alert your care team about this after 1 to 3 months.